what the Children's Oncology Group learns from having every single patient with cancer enrolled on clinical trials is how to treat children better. And it probably translates to more than just oncology, actually, but how to actually treat children better, how to treat their cancers better. And certainly some of the spectacular cure rates that we have seen in acute leukemia come from the fact that most children were enrolled on clinical trials where we learned what worked and what didn't work. And a lot of important data came out of those trials. We do not cure cancer well. We have not found a cure for cancer. I mean, we have not come very far since the 1970s in acute leukemia, for example. The major regimen or standard regimen that we use has been used since 1970, really. And I think that we would make more progress if we were able to enroll more people on clinical trial and figure out on a large-scale basis across all economic and social aspects what works and what doesn't, that we would do a better job. And it's not just the drugs, it's learning how to treat patients in a supportive way better than we do now. And I think that there's a lot that we could do to support patients better, but we have to know what the problems are. And we learn that by clinical trial. You know, the biggest objection that you hear to clinical trial really is that you don't want to be a guinea pig. But actually, I think that that's not the case at all. It's really your only opportunity for cutting-edge treatment. You are mandated in a clinical trial to have a certain level of treatment that it can't be decreased. It can't be slipshod. You have to adhere to everything that's in that particular document. So you're always getting the highest standard of care when you're on a clinical trial. A physician is always, poring over your particular case, and it's the only place that you're really going to have access to the newest treatments. And it's the only way that we're really going to learn how to treat cancer patients better. I think it's really tremendously important. I really do, that clinical trials have a lot to offer patients. And a lot of patients don't realize what all the options are for treatment. I think doctors are not always good at explaining everything that is out there to treat a patient, but it's really, really important to make sure that patients understand all of their options and all the things that they can do or not do to treat their disease. And I think the only way that we will move forward in our fight against cancer, really, as a disease, is to gather more information on how to best treat patients. And it's really, we've done startlingly little in the past, 30, 40 years.